Good morning, my name is Alex Calderon Miranda. I'm going to talk about serious asthma events with fluticasone plus salmeterol versus fluticasone alone. The definition: the safe and appropriate use of long-acting beta agonist LABA for the treatment of asthma has been widely debated. In two large clinical trials, investigators found a potential risk of serious asthma-related events associated with LABA. This study was designed to evaluate the risk of administering the LABA salmeterol in combination with an inhaled glucocorticoid fluticasone propionate. This is a little video.
Asthma is a chronic long-term condition that can be managed but not cured. Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, for some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract. The airways narrow, and breathing through them produces a whistling sound called wheezing. Mucus is produced from the lining of the airways, which clogs up the narrowed airways further and causes coughing. This makes normal breathing more difficult, producing symptoms of asthma that can be mild, moderate, or severe and life-threatening, where hospital treatment is needed. The narrowing of the airways is reversible if the trigger is removed, or if the inflammation is treated medically. Therefore, preventative treatment is used and can be managed by the patient themselves. An acute asthma attack requires medical intervention, but the type of intervention depends on the severity of the attack. For more information, visit www.nhs.uk.
Well, application in medicine. In this multi-center randomized double-blind trial, adolescent and adult patients aged upper than 12 years with persistent asthma were assigned to receive either fluticasone with salmeterol or fluticasone alone for 26 weeks. All the patients had a history of a severe asthma exacerbation in the year before randomization, but not during previous months. Patients were excluded from the trial if they had a history of light treatment or unstable asthma. This is a conference of TED that you can check in YouTube. The pros and cons: prevent wheezing, prevent bronchospasm, relax and open airways, diarrhea, headache, fatigue. This is an attack of asthma.
15-year-old Chris is having a severe asthma attack. His immune system has made what could be a fatal mistake and is shutting down his airways. And Chris's chest are squeezing tightly shut and filling with sticky mucus, blocking his vital oxygen supply. Blocking vital muscles swing into action to help Australian children suffer.
In the Asian Ecuador, the use of a single inhaler, fluticasone, propionate, and salmeterol is associated with higher costs compared to another alternative preventive therapy in asthma.
Which is produced by cells in the mucosa. Acute asthma is due to exposure to an environmental trigger, something like dust, animal dander, pollen, smoke, even exercise or respiratory infection.
That's a video that you can check on YouTube too. And the conclusion: patients who receive salmeterol in fixed dose combination with fluticasone did not have a significantly higher risk of serious asthma-related events than did those who received fluticasone alone. Patients receiving fluticasone salmeterol had fewer severe asthma exacerbations than did those in the fluticasone only group. This is an interview.
Morning, ladies and gents. Thank you. Thank you.
Which is fantastic that we've reversed that trend of the 5 to 34-year-old age group, but then not many would think that 55 or 56 is a particularly good time to demise from asthma either. And so that's the group. If we're going to reduce asthma mortality, we need to pay.
Well, you can check that in YouTube. Well, thanks.